Welcome to Ageless by Rescu. This podcast is devoted to exploring the science of rejuvenation, uncovering the most trusted experts, the must-have products, innovations, and technology in the field of vitality, aesthetics, new beauty, and cosmetic enhancement. Dr. Aman, I am absolutely delighted to host you on the show. It's a long time in the making. I first met you at the Non-Surgical Symposium on the Gold Coast, where you were speaking as a KOL. And then what we talked about immediately grabbed my attention. And I knew that I was speaking to a world-class expert on the subject of functional gynecology. And I have been stalking your socials. I've been calling you. I came and saw you when you were last in Sydney. I grabbed you the minute you got off the plane at the airport. And I am so honored to host you today on the Ageless by Rescu podcast. Let's talk about what exactly is functional gynecology. I would love some definitions to set up our conversation.
Yes, absolutely. First of all, thank you so much. That was a lovely introduction, and pleasure is all mine. Thank you so much for honoring and giving me this platform to share my views. Thank you so much. Functional gynecology is a branch of medicine that treats any disease from the root. So we believe by healing with diet, lifestyle, it's a holistic approach. Whereas conventional is more with medications and different surgeries, we can call it. But yeah, it's.
I loved when we had the initial conversation about functional gynecology. The reason that you have specialized in this area of treatment is that you are really of a belief that women should reclaim pleasure when it comes to their sexuality and their functionality. And this topic is just so interesting because you've linked pleasure with health and well-being. And when we've had the conversations, whether in person or over, the internet or whatever we've had, you've always brought it back down to the profound impact sexual wellness and functional gynecology can have on the mental well-being, on the physical well-being, on the holistic well-being of a woman, and even obviously by proxy, her partner. And so for me, it was really interesting to examine this from the perspective through the lens of being ageless, because, I'm always talking to experts about skin and health and longevity and youthfulness. And I've kind of touched on regenerative or rejuvenating treatments, but what you're talking about is well beyond rejuvenation. It's really about allowing the body to do what it was designed to do, which is to enjoy sexuality, to give and receive pleasure, to have full confidence in the body's ability to function at peak, no matter what stage of life you're in. So let's talk about how you came into the field and what attracted you to this area of specialization, because you're based in Adelaide, but you are renowned as one of Australia's top experts in this field.
Thank you. It all started with as a GP, I used to see a lot of mental health patients. That was one of my specialty, and obviously women's health runs parallel. So I found that majority of my women patients who came to me with their mental health issues, somehow their problems were related to either menopause or some of the women's health issues, whether it's postpartum. So I thought that I was just, for example, urinary incontinence. I was just giving them prescriptions for anticholinergics. And then after, trying, testing, side effects, so I used to send them over to gynecologists to get their surgeries done. So a few years later, they would come back even worse. As you would know, with the mesh, it has been banned in many countries.
I want to talk about that later because you and I know about it, but a lot of our listeners don't know about it. So we'll come back to the mesh surgery.
Absolutely.
But continue. So you would send them to the gynecologist or you would medicate them. But with the case of urinary incontinence, it would come back sometimes worse.
Yes, and worse most of the times. And we were back to square one after a few years of treatment. So I thought that there has to be something more that I need to look into and do a bit of research. So I started exploring different options available. So I started reading research papers about urinary incontinence, type of incontinence, and also comes with the vaginal dryness, low libido, sexual dysfunction. So I started doing more research on women's health because I knew, like, if I could fix women's health problems, then we would actually be able to help them mentally as well. And it has a significant impact on their mental health. And not only the women's, as you just mentioned, the partner as well. It's not only the partner, family altogether, So women's mental health is absolutely, absolutely important. So yeah, so I started my research, found that there are different treatments available, and as I believe in functional gynecology, holistic approach, so PRP, vaginal PRP, attracted my attention, and
This
I
is
read.
so fascinating to me because you're talking about, the vampire technique, or
Yeah,
PRP, platelet
yeah,
rich, sorry,
platelet rich plasma. Mhm.
platelet rich plasma
Plasma,
as a
yes.
as a treatment for vaginal issues, but it's multiple issues you started learning that this particular treatment could assist with, right?
So yes, I call it liquid gold, and hence the name of my clinic is after PRP. It's the most magical fluid in this world, I would say, healing fluid that we have got. So you inject it on your face, it rejuvenates your face. On your scalp, hair growth. It rejuvenates the skin. So it helps to heal naturally, moisten the areas, and there are growth factors released. So again, by definition, O shot or PRP, they are not categorized as functional gynecology. But I think, because if you follow the definition of functional gynecology, that is treating the root cause, what would treat us better than our own body? So I find that PRP is it should be a part of functional gynecology by
I want to
definition.
go back to completing our conversation around urinary incontinence. So
Mhm.
when we were talking over dinner, which was hilarious because you were showing me all sorts of photos and we were having a wild conversation over pizza, and the waiter, we were terrified that he was going to come and see what was on your phone. But what I think that really captured my attention is that there are many causes of urinary incontinence and many options for healing it. And yet very few people talk about it. So more recently, it's become more topical to talk about menopause and perimenopause symptoms, of which vaginal dryness and urinary incontinence can be one. But there are many other reasons for women at various stages of their lives to suffer from urinary incontinence. And there are many, many approaches to curing or at the very least improving this condition.
I think the first reason, and you're right, it's so hard to break that ice. So it's quite unconventional for someone to talk about urinary incontinence. Girls, all our girlfriends, they talk about, oh, I'm having period pain, I'm having cramps. So regarding periods, we can talk with any period pain. We'll talk, and but nobody will say that, I wet myself while coughing, sneezing, or I want to
I feel like women are talking about it just a little bit more, but really much later in life. I mean, I know in my circle of friends, we'll say, oh my God, I'm going to pee my pants. Like, oh, don't make me laugh. But you're right. We don't talk about it as a medical issue. We don't talk about it as a
Yeah.
thing that's incredibly stressful and can cause an enormous amount of changes to your life. And one of the examples you gave me when we were talking last time is, a lot of your patients, they won't even go on hikes. They've modified the way they live because they're so paranoid that they have to plan everything around being near a bathroom. There are so many things that they're not comfortable to wear anymore. They're places they're not comfortable to go anymore.
That's why I created the Tori questionnaire. It has 9 questions, and all the questions are hilarious. Whether and as women, we always have a plan B. And I have spoken on so many, instances, events, and I keep saying and keep repeating myself, uh, we just are multitaskers, and
We
we
are
know
resourceful. We are
we
certainly
are
resourceful.
resourceful. We'll use a panty liner, we'll use a diaper, we'll you carry a second set of clothes, but we will not make an effort to go and take care of ourselves and present to a doctor just because we think that we can handle it. I think partially because I think a majority of the doctors as well, they're not aware of all these treatments. So if I see myself, if somebody came to me, and if I go back to my consult notes for a few years ago, I was doing the same thing, just giving them anticholinergics or sending them to a gynecologist, because there wasn't much awareness about the treatments available. And once
What
you
are
see
some
the
of the underlying causes? Because I think that that's really important to identify. And perhaps if someone is listening to this and they've experienced, incontinence once or twice or frequently, can we talk about some of the underlying causes? And perhaps if, this triggers some recognition in someone who's watching or listening to this, they could take this information and maybe do this quiz that you've got on your website, which I will link to, and take it to their medical practitioner and say, look, I believe I have some of these underlying conditions.
First thing is, it's a myth when I say urogenital syndrome of menopause. Yes, menopausal, perimenopausal women are affected, but you won't believe my youngest patient is 19. So, and she suffers from urinary incontinence. She was too shy to talk about it, and she came to me and she was too embarrassed. Now, in her case, it could be genetics, some of the medical conditions as well. She's a weightlifter, so she's higher on the BMI as well. So a few other concerns in her case. But in general, when we are talking about urinary incontinence, there are a few different types. There is the most common is stress incontinence. And again, like you can't hold your bladder for that long. You cough, sneeze, and you leak. And then and that's usually with postpartum, childbirth, chronic constipation, different reasons for that. And then we have urge incontinence. That's usually neurological dysfunction. Nerves are a bit more irritated. So it's hard for you to hold the bladder for that long. And then that can happen both with men and women. And then we have overactive bladder, and then we have mixed incontinence, the combination of any of those. So and there is a big myth that if I have had a C-section, I won't get all these symptoms. But you have carried a baby for 9 months and your pelvic floor has been impacted. So chronic constipation, chronic cough. So those are different reasons why you can get you can get a urinary incontinence. Weightlifting.
One of the things that I found really fascinating is I have had some meetings and consultations with a physiotherapist who specializes in pelvic floor. And she showed me a model and explained to me the vast network around of the body of the pelvic floor. And it's so much more than just having strong abs or doing Pilates. And the interrelatedness of different parts of the body. So it could be from so for some people, it's about not having enough muscle tone. And for some other people, it's about being too tight in certain muscle tones. So one of the things I learned about my body is that because I was doing so much exercise, so much Pilates, so much fitness, actually all of my pelvic floor area was so tight.
So tight, yeah.
So tight. And that could be just as problematic. So that was really interesting. The way that I was breathing and using my diaphragm was problematic. I wasn't breathing deep enough or relaxing my muscles. And the reason I went and saw her is because I had a cesarean and I also had an abdominoplasty. And so twice my stomach was like cut through. And so I wanted to make sure that as part of my age management and rejuvenation and the way that I'm looking after myself, that I'm ensured that my pelvic floor is strong, that my vaginal muscles are going to stay healthy and strong. And I do believe in prevention. I've tried a million different things. I love any treatment that is for intimate wellness. I love it. I love it before something goes wrong. I think it's a great preventative step, and I always talk about it with my friends. So I'm really curious as to what you think is an effective modality to either do preventive treatment for urinary incontinence, or treatment after the fact that it's a problem.
So first thing and foremost is doing Kegel exercises. So
No one likes doing Kegel. Oh,
everyone
it's like
gets
saying you need to drink 3 liters of water. No one wants to do it.
the thing is, like, we all get the pamphlets and we all get the books. Once we deliver a baby, you gotta do Kegel exercises, and those books are sitting backwards. I have never touched anything. I myself, I would admit that after I had 2 normal vaginal births, and the first one was quite intense. So a very long labor. It was over 24 hours, and it
And
was
you're only little.
excruciating.
We're just tiny.
Yes, and that kind of obviously for first few weeks, you don't even have a chance to sleep, let alone doing Kegel exercises or giving time to yourself, and easily taken away by baby responsibilities. You're breastfeeding, you're tired, you're changing nappies, waking up at night. I don't think many women, they take care of themselves. We always put, just by nature, we put our
And
family
how many women take care of their vaginas? I mean, my goodness, like it almost seems like a really indulgent conversation to be having, but it's a very important conversation. So I can honestly tell you, I may have done Kegels twice in my life. It's so hard to stick to. It's super
It is.
boring. So
It
I'm interested to learn things other than Kegels that we can do.
I usually, how I do it and how I tell my patients to do it. When you're stopping on a red light, just have a reminder. Maybe put a sticker on your windshield so that whenever you are on a red light or you see a sticker, you know that you're going to do your Kegels, or have some landmarks in your car. Because that's the only time I honestly think I think a lot at that time. I feel like I enjoy my car rides. My work is almost an hour away, and I enjoy that ride. And that's the time when I think, when I do my Kegels. So
So
I
what
guess.
about the Emsella chair and the Tesla chair, which kind of mimics the Kegel exercises? Have you got that in your practice? Do you know a lot about that? I've tried both.
And what was your experience?
Well, I didn't have anything I was treating. It was during my preventative phase.
Yes.
So I was promised, greater sexual pleasure. It's like doing great exercises for your pelvic floor, for your vaginal muscles. So I guess like it was good, but
I don't have Emsella or Tesla chair in my surgery, but I have an alternative, which I find it works great. Have you ever tried Vetone?
no, I've heard about it though.
It's electrical muscle stimulation. So it's like a tense machine for your vagina. It
Yes.
works wonders.
Is it
Within
internal or
It's
external?
internal. It's internal. So it sits right next to. It just sits in your pelvic floor, and you can feel the contractions. And we have lovely videos. You can go to. It's part of Empower, so you can go to their website and just watch that video. It's incredible. I make my patients watch it, and so that they know what we're doing. So as you said, that our pelvic floor is a complex area to treat. So it's not only the muscles that we are treating, but it's soft tissue, it's vaginal laxity. So there's a lot more that we are treating just than the muscles. Kegel exercises, they help, but with time, age, laxity, you can only do so much. And practically speaking, the intensity of Kegel exercises that you can do, it's I mean, if you're doing it once a day, and majority of the time, 80 to 90% of the women, they don't even know how to do Kegel exercises, or pelvic floor exercises. I mean, some of them, they don't even know Kegel, but it's just alternative for pelvic floor exercises. And simple things, as you just said, you were breathing wrong, and 80 to 90% of us, we do that. And even like for myself, I would know what I'm doing, but it's just that subconsciously you're not even aware of most of how just you're not aware of your body because you're so preoccupied with other things.
What
So
about lasers and other so a very popular treatment was called the Mona Lisa touch.
yes, yes.
That was hailed as a great breakthrough for
Mhm.
I think it was for stress incontinence.
Yes, almost a decade ago it came out. Now it's just that with all whether it's Emcella or laser, there are more limited a number of patients that you can use it on. So because of electromagnetic field, so you can not use it with the people with pacemakers.
Okay.
So whereas here. You can just use it's just TENS machine electrical stimulation for your muscles. So we
So
don't
that's safe for everyone.
majority of yeah, again, like we have to do a pelvic floor assessment first, but yeah, it's relatively safe for majority of the people.
But I'm going to be devil's advocate. There are going to
Mhm.
be, look, most people hate having a pap smear once every 2 years. Having an
I hear.
electrical pulsing device inside your vagina at a doctor's surgery is going to be a mental leap for a lot of women.
Oh, they love it. Trust me, you gotta try it before. I call it orgasm bond. It's more like a vibrator for most of the women out there. So that's my orgasm bond. Then we have magic wand. So that's the Forma V. That's the
The
bipolar radio.
Forma V, that's right. That's what
Yes,
you were
it is.
speaking on at NSS. Let's talk about the Forma V because this is kind of next generation therapy. And it does more than just urinary incontinence. It
Yes,
does a lot.
absolutely. So we have Forma V that is bipolar radio frequency. It kind of heats up the tissue, heats up your glands, and it's a regulated heat. So we
So
kind of
the
heat
heating also firms the tissue, right? So
it.
it actually can have an aesthetic benefit as well
Yes,
as a functional benefit, correct?
yes. And you have seen the photos. That's from Forma V.
I saw all the photos. We were literally just at dinner, and Dr. Oman had before and afters, and they were very gynecological. And we were just trying to hide it from the waiter, so he didn't think what were these two up to.
Yeah.
So talk
So
me through the technology again.
yes.
So explain it to whoever's listening and reading, because this is
Mhm.
really interesting.
Yeah, so FOMAV is real time. We monitor the temperature. So temperature is regulated. So on my machine, I know what temperature I have set in. So because of bipolar radio frequency, so everything is just concentrated. So we are heating the tissue in that focused, concentrated area. So it kind of, with age, your collagen bonds, they kind of start going apart with gravity. Whereas once we heat them, we bring those collagen bonds together, so everything just goes back to usually it looks like we have at least done reversed the age for 10 to 15 years, if not more.
So it's an age reversal treatment.
Very likely it is. I believe it's I mean, you have seen the before and after photos, so it is
They're quite astonishing. I mean,
yeah, and
truly.
that too
And
with
that was only after like two or three
three
sessions, right?
treatments
Three.
three treatments once a month, three treatments, and that's we do internal for 12 minutes and we do external for 8 minutes. The photos that you saw, that was only 8 minutes of the external treatment.
Three
So
times.
24 minutes.
Amazing.
So
And
24 minutes.
so in terms of the treatment that we're talking about right now, again, how do you get past the psychological barrier of having such an intimate treatment? Like how do we speak to our doctor or our healthcare provider? What advice would you give? Because you must have this conversation all the time with women of different ages, from different backgrounds. Certainly, if they've come from a background of having sustained any kind of trauma to their area, this
Yeah.
could feel like an invasive treatment.
So first thing is starting from OSHOT. So I'll just tell you how I usually consult my patients. So usually they just come in for a pap smear just as a routine check. So while doing their smear test, I always make sure that I ask them questions regarding urinary incontinence, vaginal dryness, laxity, low
I've never
libido.
had any of these questions asked during my pap smear, never once, not half a time. No doctor has ever asked me anything during my pap smear about my
That's
vaginal health.
quite normal. But as I said, I wouldn't have been asking those questions couple of years ago, and hence I'm training doctors to ask right questions. Because patients,
Well, we appreciate you, Dr. Aman.
thank you. It's more about, just being aware. Now we know that we can treat it, so I'll ask questions. I never asked those questions a couple of years ago because I did not know what to do with it. When women came to me about low libido, is there a Viagra for us? No, I don't know much about it. So, I did not have answers to it. But when they come to me, I have answers. I can show, and fortunately 100% results for us. So all my patients, they have been happy. They have given me Olaf hugs, as I call it. So after their treatments, and it's a game changer. It's a game changer.
We're skipping around on the different treatments. I want to keep on. I think it's really wonderful what you're talking about, because you're talking about you, the doctor, going through an inventory of health related questions.
Mm-hmm.
But what if we are not seeing you? What if we're talking to a doctor who we have to bring up our concerns? What would be your advice when, having a pap smear or going to see our GP? What are some of the things that we could share with them? And what are some treatments that we could ask for additional information on?
Again, as I said, it's a fairly new treatment. So it was only approved in Australia last October. So it has been in US and Europe for years. For example, P-shot, O-shot or P-shot. So O-shot was invented in 2011. So US already has had it for almost 12 years, whereas it's something very new. And if Kim Kardashian didn't say anything about it, nobody would have known here in Australia.
But, painful intercourse or pleasure is a sensitive topic. It is a hugely private topic. And I know we're meant to have great relationships with our gynecologist or with our GP, but I don't know if they're the first person you want to run to and say, I don't want to have sex with my partner. It's, it's kind of like, I like the idea of doing your survey anonymously on your website so that you can get a sense of where you sit on the scale.
Mm-hmm. So right now I would say I am creating and I'm building this tribe where I think this is very early stage for me to answer that question, because we need army of doctors, we need army of nurses, dermal therapists, so that A, these questions are asked, B, the answers are given. So, and I encourage, and that's why I have put that questionnaire on my website. I'm more than happy to answer and guide you in the right direction, whether you're overseas, whether you are, I can help you find the doctors who know these treatments, or at least I can help you find, at least I can help you what you need to do next. Just email me. I'm more than happy to guide you.
So far we've talked about incontinence.
Mm-hmm.
Then we've talked about reshaping or anti-aging treatments. But let's talk about the O-shot, because this is, it's got a really sexy name, O-shot, referring to the big O. And so it's kind of the primary promise that this treatment makes. So I'd love for you to talk to us as to what it is, how it works, and all of the things that it can potentially treat.
Yes, so I'm very passionate about it, as you know, me and O-shot and PRP. So it is a revolutionary treatment, and as I said,
I've never had this treatment. I totally want this treatment.
I've told you should. Yeah,
I'm coming.
Yes, anyone who has had it, they will definitely tell you.
I have referred friends to it before, and they've had it and they did love it.
Yes.
But I've never had it before, but I'm going to have it. Why not? I'm about to turn 50. It seems like a wonderful gift to self.
It's a preventative treatment, as I said, and you said you love preventative treatment. So do I. And being a GP, it's all about prevention. So I'll just tell you how I have incorporated O-shot to my practice and how I consult with my patients. So going back to that example, I see a patient for cervical screening, ask them questionnaire, ask them those questions. If they have any concerns, obviously while doing a smear test, I will examine their pelvic floor as well, and I'm able to gauge what's the concern and how I can help them. Because there are different treatments. There is Morpheus 8V as well, which is microneedling and radiofrequency. So there's a combination that we try. Morpheus 8V, we try Forma, and we have Vetone. There's a lot to offer. I know that these treatments are a bit expensive, but they're worth it. Once you have fixed yourself, you're not coming back every year. There's a $32 billion diaper industry. So if you
Wow.
can, yeah, it is
And
huge.
also, like, honestly, the stigma of adult diapers is so much, and women
So
like
much.
and men don't want
Mental
to
health
talk about
again.
the mental health aspect
Yes,
of it. Yeah.
absolutely. But well, you just imagine yourself. I always put myself in my patient's shoes when I'm doing their smear test. And when I do O-shot, I haven't even had a single patient who said if they have rated me over, they always say it's -1 or 1 on a scale of 10.
In
So
terms of pain.
in terms of pain,
Yeah.
I know it sounds terrible. It sounds a bit horrific when I say somebody is injecting plasma in your vagina, but it's painless
So
procedure.
it's your plasma too. That's the other thing. So you extract the blood,
Exactly.
just like PRP for the face
Yes.
or any other
Yes.
part. You extract the blood, you put it through a centrifuge,
Mm-hmm. Yes, so
extract
we
the plasma.
extract the growth factors. Now, those growth factors, I usually, before doing O-shot, I prep my patient first. I think I bring my holistic approach there. So I like to give them supplements. I check their blood work just to see if there's any
What
chronic
supplements can we take for our vagina?
So anything that would help us get great growth factors. It's so PRP is all dependent on the quality of platelets, and the growth factors are derived from the platelets.
So what do you
We have
suggest we take before our
vitamin
PRP?
D. Vitamin D, it's B, folate. B complex is great. Vitamin K comes usually with vitamin D. So I have a list of supplements that I give my patients, and also what to and what not to do, like anti-inflammatories. There's no point of taking anti-inflammatories and doing PRP. Smoking. If you're a smoker, I would say rather put your money in the bin. There's no point of doing PRP. So you have to be realistic that what will work and what won't.
So what you want to do is have the best quality blood, therefore the
Exactly.
best quality plasma. So you do some prep work to make sure your blood work is just primo.
Mm-hmm.
You
Mm-hmm.
come in, you have that extracted,
Mm-hmm.
you get the
And
growth factors, and then that's injected into your vagina.
yeah, yes, so we numb the area first. So I
I hope
do
so.
a strong numbing agent. I do a strong numbing agent first, then I do a block as well, and then we inject. So, which is quite tolerable. And as I said, my patients, all they do is they just feel my fingers. And even before they know it's done, they usually rate it from -1 to 1. And if somebody,
So how
if
many
you are,
injections would you have? And I always think, when I hear O-shot, that it's near the clitoris. Is that
yeah,
correct? Is that
yes,
where you're injecting?
that's part of the O-shot, and then we inject in the anterior vaginal wall as well.
Gotcha. And
Yeah.
then how soon is this a one and done treatment? Is it a one-off, or do we have to keep coming back for a series of treatments?
So ideally, it's recommended once a year, and around, I would say, if you're menopausal, then I would say maybe 9 months to a year's time, because you will know when you need it. So once you have done, or once you have gotten O-shot, you will see a huge change. And once you start going backwards, you'll come back. You will know that something is missing.
So in
And
terms of the O-shot, is it increasing sensitivity, or is it lubrication, or what is it that it's fixing?
so what happens once we inject, we activate the PRP. So this is not just like I have taken your blood, I've drawn the plasma, and I have injected it just like we do it on your face. So once we want concentrated effects, we activate our PRP. So as soon as the PRP goes in, so it kind of activates growth factors, and that the process starts as soon as an hour. So there are different types of growth factors: endothelial, insulin-related growth factor. There are what these growth factors, they kind of lay mattress, increase collagen, lay new blood vessels, angiogenesis, neogenesis. That's laying new blood vessel in that area, and then we get nutrition from our blood. So we have laid new blood vessels. So that means new blood supply in that area. So we kind of get more nutrition. The vagina is no longer dry, and everyone is happy.
Now, there's also a thing called the P-shot. What is
Yeah.
that?
So that's for penis.
So where
That's
do you
for
inject that?
huh?
Where do you inject it?
In the penis.
Wow. And it has exactly the same benefits?
So it is more for erectile dysfunction. So it has a very similar So usually I never thought I would do P shot. I mean, I was trained for P shot, but I never thought I would have many patients for P shot. Surprisingly, the women that I treated for O shot, they brought their husbands and like, you got to fix them now. They can't keep up with us. That's how I ended up treating P shot guys.
Wow. So, okay, what other treatments are available? I mean, you and I talked about labiaplasty, and
Mhm.
so in terms of definition, that's a surgical procedure to
Yeah.
change the aesthetic appearance
Mhm.
of your labia.
Mhm.
But you were saying that a lot of patients who come to you wanting a referral for that surgery, you're
Mhm.
now suggesting that they try the former V first. Is that correct?
Absolutely. Now, you can only, whatever I'm saying, you will not believe it unless you have seen those photos. So if I
I
can
can't show
help
you the
my,
photos on the podcast. So
just
I think
write
the
an
YouTube
email.
channel would be.
Send me an email and I'm happy to share it privately with any of the listeners if they want to see the photos. And it is just that it's the heat. It's non-invasive, and I know it's a controlled temperature, so I'm not doing any harm there. And all I'm doing is just shrinking that area, so bringing the collagen bonds together and just increasing the elasticity. So it's like an additive treatment. So usually what I tell my patients is like, I have given you protein. So I have first on week 1, I start with O shot. So I give them O shot, which is like putting seeds in their vagina. So now we have given heat. Next following week, I start with Forma V, Morpheus 8, or
How does the
Retone.
Morpheus 8 work? We didn't
It's
talk
pretty
about that.
good.
So
So
what is the process of that instead of the former V? How is it different?
so Morpheus 8, I know Morpheus 8, it's people have this phobia about pain regarding Morpheus, but vaginal Morpheus 8V is painless. Maybe you'll rate pain 1 on a scale of 10, maybe 2. Some patients, they don't even know. So they tolerate it really well. So we do put a numbing cream before. So it's quite a tolerable procedure. So the difference between Formavi and Morpheus 8 is Morpheus 8 is microneedling and radio frequency. So it's a very strong treatment. So it's a master treatment. That's my
So,
master tool.
so that treatment would be for aesthetic, it would be for functionality, it would be for dryness, it would be for
Yes.
tightness, it would be for
Everything,
pleasure enhancement, everything.
everything in one.
And is
So
that also something you would have to come and have 3 times?
yes, so Forma V and Morpheus 8V, they are recommended once a month, at least 3 treatments. So, but you'll start seeing the change with the first one, and you would want to get the next one just to see, because with the results are instant.
Can I ask you how much these treatments cost? What are we talking about for, let's say, Forma V? What is a treatment series? What does that cost?
Usually we combine it in a package because one treatment alone won't really make sense.
Yes, yes.
Because
So
it's not going to give.
yeah.
Yeah. So packages can range. I mean, like O-Shot. I it's somewhere between 1,200 to 2 grand, depending on which area you are. So here we charge around 1,200 to 1,500 just for O-Shot, whereas we do combine it in package and then it becomes cheaper.
So
In
you
Sydney,
combine the O shot along with the Forma V or the Morpheus A
yes,
treatment.
yes, yes.
Got it.
Because then it's cheaper for them as well.
Yes. And
The thing is,
also, what was the first treatment you said? The electrode,
retone, retone,
the
retone.
Wetone. That's right.
So that's recommended once a week for 6 weeks.
Okay.
So depending on, like, Morpheus 8V is a bit expensive than the other 2 modalities. So you can do a combination. And again, like, I can't give you a price
No, just if
such,
for
but
the
a range would
listeners.
be somewhere around between, it can go up to 5 to 10 grand, somewhere around that. So
And you
if
would recommend that this is something that you would consider doing it once a year?
Not once a year. So initially, yes. So we have fixed your soft tissue. We have fixed your pelvic floor. So you're good to go. So you can just do a touch up maybe a couple of years after, depending, as I said, if you are I ideally think that the ideal candidate is right after birth, postpartum, few months later, because PRP will just heal the episiotomy scars or any problems that they have had from the episiotomy scar. Because I've seen patients suffering from it, suffering from the pain and the scar contraction from episiotomies. So a couple of months afterwards is ideal time, and then also there is
Which is also such a funny thing to say, because of course, after you've had painful birth, the last thing you feel like is having needles around the area, but you're saying it's a wonderful treatment to help
it's
with the scar.
it will heal. It will heal. PRP heals. You inject it anywhere, it'll just heal the tissue. So you're kind of healing yourself. And then on top of that, you do need Kegel exercises. So I usually combine O-shot and V-tone for postpartum women. And they usually say, oh, I want to finish my my family, and then I'll consider the treatment. I think that's a wrong approach, because it's our pelvic floor muscles, vagina is just like an elastic. The more you stretch it, it's just never going to come back to normal. So every time I think it's a good idea to just bring it back and then have another baby and stretch it more. But yeah.
Well, the timing for our conversation is quite timely, because I think tomorrow night in Sydney, I don't know when this episode is coming out, but I'm going to go and see Gwyneth Paltrow. She is speaking, and she really put treatments for the vagina on the map when she started talking about steaming her vagina as a ritual. She released a candle that supposedly smelt like a vagina. And just this week, I was invited to 2 different beauty launches for products that were for intimate care. And I'm wondering, as a doctor who specializes in functional gynecology, and you have such a passion for helping women restore the health of their vagina, the health of their pelvic floor, do you have any thoughts or preferences on products to clean, to moisturize, to treat, other than the devices and medical treatments we discussed today? What do you think? Should we be using intimate washes? Should we be using special moisturizers? Are there other holistic treatments that you think are worth investing in?
I usually recommend vaginal health probiotics. So they're very important. And make sure the ones that you can get from iHerb online, but make sure you're taking vaginal health probiotics, especially around your periods and after you have finished, because women, they commonly suffer from recurrent thrush, bacterial vaginosis. So the pH of your vagina is very, very important. And I'm not after, like, I don't really advertise any fancy or expensive brands. So all I say, just stay natural. Anything that your body likes, just non-fragrant and hypoallergic, anything, a normal body wash. I usually love, anything that a baby can use, we can use. I keep it simple that way. But douches and other stuff, we really don't need to use it. Just cleanse, just normal, just like a normal shower, and that should be more than enough.
The other thing that we talked about when we were together was the use of estrogen cream or estrogen pessaries as an internal treatment that could be potentially beneficial for discomfort in intercourse or vaginal health, and a regenerative medicine. Is that something that you do recommend to your patients and you do prescribe for women, whether it's at around peri or menopause, or any time that there's a dip in estrogen production?
Absolutely. As we enter the perimenopausal cycle of our life, the estrogen levels start to drop, and hence leading to dryness of the vagina, and leading to change in the pH and recurrent infections. So yes, we do have to prescribe estrogen. It's a part of HRT. It's not only estrogen, because we do need progesterone to balance your endometrium. Otherwise, it can lead to endometrial cancer. So it's very important when you are taking estrogen. It's not just like any lube. It's a hormone, so it has its own side effects as well. So make sure that you are seeing a health professional, and it's the dose is regulated, and like anyone who has had a hysterectomy can use estrogen by itself. But if you have intact uterus, you need to have progesterone in order to balance that endometrial lining. Otherwise, it leads to endometrial cancer, which is unregulated hyperplasia of the endometrium.
But
So
but you do recommend that it can
yes,
be a helpful and inexpensive treatment, right?
absolutely, it is. And again, as I said, we have to. It should be monitored. As long as it's monitored by someone, it's fine. It's fine. We do like I do prescribe bioidentical hormones as well. So that's the
I
part
take
of.
bioidentical hormones, and like they were amazing, like such a
Yeah.
life changer.
Yeah.
Let's talk about other conditions that come up, regardless of what age you might be, that are related to this topic. Um, and that would be recurring UTIs and recurring thrush. Are there any holistic treatment options for women, young, old, in between, that you think can be quite beneficial as a natural and holistic treatment of those issues?
Yes. So first and foremost is weeing before and after intercourse. That's very important. Taking vaginal health probiotics,
So
right dose.
is that an oral supplement, the
Yes, you can
probiotics? Yeah.
take oral ones as well. There are some vaginal suppositories as well. Then you can, Forma V actually helps a lot with recurrent UTIs, bacterial vaginosis, and O shot. So as I said, it kind of resets everything. So you do O shot, then you do Forma V for recurrent vaginosis and candidiasis, that's the thrush, or recurrent UTIs. I mean, obviously, we have excluded all the medical history. I have done the pap smear, and I have made sure before doing any of the treatments, especially when with the menopausal women as well, it's important to make sure that there is no lichen sclerosis. We have done a biopsy before starting these
Sorry,
treatments.
I missed what that was. There's no what?
So, so when we are treating before prepping the patient, it's very important to rule out that the patient does not have a lichen sclerosis. So that just to confirm that the patient has lichen sclerosis, that's by biopsy. So in all these treatments, PRP or shot helps a lot with lichen sclerosis, but we need to make sure that it has been diagnosed, and the only way to diagnose is by a biopsy. So make sure that the gynecologist has biopsied that area before going for O shot. So it's important to clear yourself medically. So having
Do
your
we
pap
need to
smear.
tell the clinic that we're going to, or do we need to tell our doctor that we're going to go and have an O shot or the V former? Is this a conversation that, multiple practitioners need to be involved with? Or, if I don't want to talk about it with my gynecologist or with my GP,
Mhm,
is it
mhm.
safe enough for me to go and have an O shot? Is it safe enough for me to go and have the V former at a clinic that specializes in this?
So if someone is doing O shot, if you're going to a certified provider, like I'm the only trainer in Australia right now, so I make sure that I have laid that importance that my trainees, they know that they're going to rule out all the red flags before doing an O shot.
Right.
So if you're going to a certified provider, they should
I'm
know
going to
what
go
they're
to
doing.
one of your, I'm going to go to a certified provider because I just found out, I saw an email that went around at All Saint with Dr. Joseph Hakik's clinic that they're going to be offering OSHOT and treatments. Because honestly, I just don't want to have this conversation with my doctor.
It's absolutely fine as long as there are only a few things that you need to remember. Your pap smear should be up to date. If you have genital herpes, take a prophylactic, and if you make sure that you don't have lichen sclerosis, as I mentioned, should be biopsied and known.
Great.
That's just a few things to remember. Mm-hmm.
And in terms of where are we going with this technology, we talked about Mona Lisa Touch, and you said that was about 10 years ago, and now Forma V is really at the forefront, and you're a KOL for that particular company. You speak at a lot of conferences about Morpheus 8, about Forma V. You're the Australian trainer for OSHOT. So you really are at the forefront. And I imagine that you go to a lot of conferences and you're reading a lot of papers on what's next. What do you predict is the future of this particular area of functional gynecology?
I would again. There is always controversy related with regarding these definitions. So I'll just say it's functional women's health treatment that we are talking about, and I think it has a great future. It's just awareness. So people need to know that what treatments we are providing. Health professionals need to be trained about these treatments as well. As I said, in Australia for caps, we have a caps scheme where we provide adult diapers. Like we pay them some amount of money. I think it's around $650 a year. So I believe that if we can divert that money for preventative treatments like these are newer treatments, but obviously these are now people are paying so much for these treatments, but we are seeing great results. And if we can just kind of subsidize these treatments, that'll be great. That'll be a great help. But in order to do that, more health professionals need to be aware of these treatments, and hence I'm big on training. And even like next week I'm going to Singapore and Tokyo, so I'm training the gynecologists there, how to do this treatment. So we are definitely moving forward. It will take time, I guess. In next couple of years we will be sitting very comfortably and people will be coming down, just like now. Few years ago nobody knew about Morpheus, and now people come for consultation. Can I get Morpheus? So I think it's
I
just
never in
something.
my wildest dreams thought that you could have that treatment as an intimate treatment. I
Yeah.
didn't know you could.
And like Ketone, it's the only FDA approved vaginal device for Kegel exercises. So, I think there are.
Are there at-home devices that, so for people who are just like mortified, they don't want to go to a clinic, are there any at-home devices that you would recommend or you're aware of that are worth exploring?
I mean, I think online nowadays there are many. There are different. I guess you can find devices, but I'm not sure. You won't be. You don't want to insert anything in your vagina and cause infections or problems. I would not recommend that, because it's best to be done in a sterile environment, like we in aseptic area where we are taking care of. You don't want to introduce infection. You know.
So
So.
just to wrap up, if
Mhm.
anyone who's listening to this interested, the treatments that we talked about, they can just Google it and find a provider nationally about that offers these treatments. Is that correct?
That's right. So if you want to any of the treatments, so all I would say is there are only a few things to keep in mind. First, which treatment? First, what are your problems? Just sit down, think about it. Just make a list of your problems and see what are the treatments available. Second, find a provider. Make sure they are certified, well trained.
How do we know whether they're certified? I mean, ASAPs did an incredible job of raising awareness about understanding who is a surgeon and who's not. But how do we find out in this area who is certified? What are the questions to ask? What to look for?
Nothing nowadays. Google is a blessing. So all you have to do is Google OSHOT certified provider. So there's a provider directory, but make sure you go to their official page. So once you go to their page, click onto Australia, click onto your state, you'll know who's the official provider. Just go to the official provider.
And the the former V, is that the same? We look up former V and then look at providers.
Absolutely. So you go to the InMode website, you just Google the providers in your area and you'll find a few. So all the clinics that have these devices, they're all trained. So they're all trained professionals.
This was such a great conversation. I know that it's just the tip of the iceberg. And I just want to thank you so much for making time to have, this very informative and useful conversation. I hope that if you are listening to this, you tuned in like you were listening to two of your friends, two sisters, certainly to have a doctor with the qualifications and the experience as you, um, is such an honor and a pleasure. I'm absolutely delighted that we were finally able to record this episode. Thank you so much for joining me.
Thank you. I just want to say one thing else. That's big on preventative screening. That's cervical cancer. So I'm sure you guys would have known that ex Miss Universe, she was only 26 and she died of cervical cancer. So as a GP, I always advocate. And now in Australia, we have a cervical screening every 5 years. And there's also a self-collect kit. So it's very, very important to make sure that you have done your pap smear or cervical cancer screening. And it's every 5 years. Might as well just help yourself, prevent yourself, and start taking care of yourself.
Thank you so much for actually bringing that to our attention. I think it is always a health conversation first, and I think with Ageless, with longevity, with cellular wellness, it is really good to remember that we first of all we want to be in tip-top condition, and also know our internal dashboard. And there's nothing better than taking advantage of the tests that are now able to give us so much excellent information about what kind of health we're in. So I appreciate that reminder as well. Thank you.
Absolutely, because there are only a handful of screening tests we have got. There's a bowel screening one, breast screening one, cervical screening. There are not many tests otherwise. So, for example, for ovarian cancer, unfortunately, we just diagnose it in the later stages. We can't do much about it. So definitely take advantage of the tests provided. So a couple of months ago, I had a patient. So she came in, and as my nature, I always ask them about their pap smears, history, allergies, and all that. So I was updating her history. She was a new patient to me. And I asked her, when was your last pap smear? She was over 20 years ago. And when I asked her about
20 years ago,
20 years ago,
that's wild.
she was 55, and I asked her about family history. She goes, mom had cervical cancer and she died at 40. And I said, in spite of that, you did not have a pap smear. And she goes, I was too scared. My last pap smear was traumatic and I don't want to go back. It was a really bad experience. And I was like, okay, you are here. And I had patients waiting in the waiting area. I was like, let's just do it. And trust me, it won't hurt. So I kind of convinced her. She did a smear test and she goes, this was the best smear that she has ever had. I used obviously a few different techniques just to relax her, calm her down. And for patients as well, whenever you go for a pap smear, make sure you are relaxed, your thigh
But the
muscles are
self-test is a great thing to that as well. So if you are anxious about it, if you are self-conscious, if you are traumatized, do the self-test. It's safe and it's valid.
Yeah, but not many people know about it.
We're
So it is
telling you
still a
about
new.
it. Please do the test.
Do the test somehow. And so unfortunately, she was diagnosed with cervical cancer when her results came back.
No.
So, and I have since then made such an effort that any patient that I see for last few months, have been asking them, go have a girlfriend date, get all your girlfriends do the pap smear together. So this is important, and I cannot lay more emphasis. That patient, and then we had the Sex Miss Universe, 26 died of cervical cancer. So, and here we start the screening at 25 in Australia. But if you have symptoms, and the symptoms are painful intercourse, postcoital bleeding, just make sure you seek help. Even if you have had your pap smear and it was good for 5 years, and if you have developed these symptoms again, make sure you go and get yourself examined.
Great advice. Great advice. Thank you, Dr. Aman. Wonderful to speak to you.
Thank you. Thank you.